You're 60 years old. Month 1, you notice erections aren't quite as firm as they used to be. You think it's just age. Month 3, penetration becomes difficult. Month 6, you need medication just to get halfway there. Month 12, nothing works anymore. Not pills, not injections, not desperation. Here's what nobody tells you. There's a window. A narrow, biological window between month 1 and month 3 where everything happening in your vascular system is still reversible. After month 3, you're not just dealing with function anymore. You're dealing with structure. And structure doesn't forgive. I'm Dr. Marcus Sullivan, and today we're talking about the timeline nobody wants to discuss but every man over 60 needs to understand. Because the difference between temporary dysfunction and permanent impotence isn't fate. It's timing. If this resonates, hit subscribe and activate notifications so you don't miss the detailed protocol. Let's start with what's actually happening inside your body during these 12 months. Because this isn't about libido or psychology or stress. This is pure vascular biology and it follows a predictable pattern. Month 1. Your endothelium, the single cell layer lining your blood vessels, starts producing less nitric oxide. Think of nitric oxide as the signal that tells your arterial walls to relax and let blood flow. Without enough of it, your vessels can't dilate fully. The result? Erections that are 70 to 80% of what they were. Firm enough to function, weak enough to notice. This is the functional phase. Your vessels are still healthy. The cells are still alive. The machinery is intact. It's just underperforming. And here's the critical part. Underperformance is fixable. Month 3. If nothing changes, your endothelial cells start becoming dysfunctional. They're not just producing less nitric oxide now. They're actively producing inflammatory signals. Your immune system interprets this as damage and sends repair cells. But these repair cells don't repair. They remodel. They lay down collagen and fibrous tissue inside the vessel walls. This is the transition point. You're moving from functional deficit to structural change. The window is closing. Month 6 to 12. The remodeling accelerates. Your penile arteries, which are already the smallest in your body, become stiff, fibrotic, calcified in severe cases. Blood can't get in even when the signals are strong. Medications that worked at month 3 stop working at month 9 because there's no healthy tissue left to respond. By month 12, you're looking at structural impotence. The tissue has changed. And changed tissue doesn't unchange without aggressive intervention that most men never pursue. Now let's talk about the 3 mistakes that turn a reversible problem into a permanent condition. Mistake 1. Waiting for spontaneous recovery. Men treat early erectile weakness like a cold. They think it'll pass. It won't. Endothelial dysfunction doesn't resolve on its own because the factors causing it, chronic inflammation, insulin resistance, oxidized lipids, are still present. Every day you wait is another day of inflammatory remodeling. Passivity isn't neutral. It's progressive. Mistake 2. Treating the symptom instead of the system. You get a prescription. The pill works for a while. You think the problem is solved. But medications for erectile function are vascular band-aids. They force dilation in vessels that are becoming less capable of dilation. They don't stop the underlying endothelial damage. They don't reduce inflammation. They don't prevent fibrosis. You're buying time, not buying reversal. Mistake 3. Ignoring the vascular warning. Weak erections at 60 aren't just about sex. They're a sentinel event. Your penile arteries are showing you what's happening in your coronary arteries, your carotid arteries, your renal arteries. If you're at month 3 with erectile decline, you're likely at month 3 with systemic vascular decline. Ignoring this is how men end up with heart attacks they never saw coming. Drop a comment telling me which month you're at right now so I can prioritize the content you need most. So what do you do if you're in that critical window? What does vascular reversal actually look like before month 3 becomes month 6? First, you address endothelial function directly. Your goal is to restore nitric oxide production and reduce inflammatory signaling. This means prioritizing foods and compounds that upregulate endothelial nitric oxide synthase. Dark leafy greens rich in nitrates. Beets. Pomegranate. Fatty fish high in omega-3. These aren't supplements. They're raw materials for the enzyme systems that produce nitric oxide. Second, you eliminate the inflammatory triggers. Refined carbohydrates and seed oils are endothelial toxins. They generate oxidized LDL particles that lodge in vessel walls and activate immune responses. Remove them completely. Not reduce. Remove. Your endothelium can't recover while it's under constant inflammatory assault. Third, you restore insulin sensitivity. Insulin resistance is one of the primary drivers of endothelial dysfunction. When your cells stop responding to insulin, your pancreas produces more. Chronic hyperinsulinemia damages the endothelium directly. Intermittent fasting, resistance training, and carbohydrate restriction can reverse insulin resistance in weeks, not months. Weeks. Fourth, you mobilize circulation. Your vascular system responds to demand. Sedentary living tells your body it doesn't need robust blood flow. Movement, especially movement that elevates heart rate and challenges the cardiovascular system, signals your endothelium to adapt. Or, sprint if you're capable. Daily. Fifth, you consider targeted support. L-arginine and L-citrulline are nitric oxide precursors. Pycnogenol has evidence for improving endothelial function. Coenzyme Q10 supports mitochondrial energy production in vascular cells. These aren't magic. They're metabolic support for a system trying to recover. And here's what you need to understand. This protocol isn't about trying harder. It's about intervening earlier. The man who starts at month 1 has a completely different outcome than the man who starts at month 9. Same protocol. Different tissue. The pharmaceutical industry profits from late intervention. They don't make money when you reverse dysfunction at month 2. They make money when you're dependent on medication at month 10. I'm not saying medications don't have a place. I'm saying they shouldn't be the first line when the first line is still open. Check the pinned comment for the complete vascular recovery checklist. If you're watching this and you're past month 3, don't interpret this as hopeless. Recovery is still possible. It just requires more time, more precision, and often professional guidance. But if you're in month 1 or month 2, you have an opportunity most men don't recognize until it's gone. Your vascular system is speaking. Weak erections are the message. The question is whether you're going to listen while the window is open or wait until the message becomes permanent. This is educational content. For persistent symptoms or serious conditions, seek medical evaluation. Nutrition complements and does not replace treatment.